So a question I get asked all the time is, should I become a radiologist? People have this really strange perception that radiologists lock themselves away in a dark room and are super antisocial, but that is a complete lie. Here are 5 reasons that I can hopefully convince you to become a radiologist. So I'm going to be completely honest, the main reason I chose radiology was purely for the lifestyle. In my junior doctor years, I rotated through all the main specialties, you name it, medicine, surgery, A&E, geriatrics, psychiatry, pediatrics. I actually really liked medicine, but what I realized is the medicine you learn in medical school is not the medicine that's actually practiced on the wards. A lot of it is ward rounds till 3 p.m, endless jobs, endless bloods, sorting out a patient's social care, making sure their house is clean before they can be discharged. It's all silly stuff which I just wasn't fulfilled. And I'm generally quite a laid-back guy, and I just wanted a change of lifestyle, and radiology has provided me exactly that. The job's 9 to 5. When I was a resident or a registrar, I was only doing 2 nights-ish a month and 1 in 6 weekends. You know you're going to start at 9, and I never finished a minute after 5 unless I wanted to stay extra and learn. My on-calls were predictable. The pace of work, whilst it does get busy, it's not like running around on the wards. And ultimately, what I tell people is, I feel like I'm essentially paid to look at pictures and drink tea. And for those of you that know me, I'm a big, big tea fan. So I love the radiology lifestyle. And as a consultant, you can work from home, which is brilliant. And the other thing is, when you're on the wards or doing kind of a medical hospital-based specialty, you're often expected to publish and out of hours collect data. Radiology isn't an academically driven specialty in that sense. I mean, sure, you can pursue that if you wish, but I just really disliked the whole idea of publishing for the sake of publishing to tick a box. And, radiology's provided me with a really nice, relaxed life so I can do things outside of work and so I can spend time with family, spend time on things which actually really matter to me. So for lifestyle, it ticks all the boxes. Secondly, I feel as a radiologist, I'm actually providing valuable input. As I said, doing those endless bloods and calling specialties, referring your patient, I just didn't find that fulfilling. Titrating a patient's furosemide by 15 milligrams every week to see if you could offload them by 100 milliliters of fluid, it was not what I thought medicine would be. Clinicians now are so dependent on imaging. Back in the day when I was a medical student, you were taught if a patient presents with abdominal pain and you think it's appendicitis, take the patient to theatre. Now, that's not even a question. You get the imaging first, and guidelines are shifting towards that and have shifted towards that. Clinicians are so reliant on imaging, and so they should be. I would much rather have a CT scan, if God forbid I ever get appendicitis, than have a surgeon put their hand on my belly and think, yeah, he's got appendicitis, let's take him to theatre. So that means the radiologist role has become so valuable because you're providing the diagnosis for so many cases that walk through the front door. And that to me is far more fulfilling than what I was doing as a medic or an A&E. The other place you see radiologists' valuable input is in the MDT. That's a meeting that you'll have with, for example, other cancer doctors or oncologists, and you'll discuss patient scans, and the oncologist will ask you, look, do you think this is cancer? Do you think the cancer is getting better? Do you think the cancer is getting worse? And again, what you say is basically what they will take as truth, and they'll treat the patient accordingly. So your report and your input is having a direct impact on what happens to the patient, and I really love that. Thirdly, I see radiology as a puzzle. If you're someone that likes problem solving, you will absolutely love radiology. If I were to summarize it, radiology is basically anatomy plus pathology. So I'm a huge nerd, and at university I used to love pathology. I've read Rapid Review by Goljan, I've read Pathoma by Hussein Sattar. I'm an absolute sucker for pathology, but I hated anatomy. But actually, as I went through my training, I really gained a love for radiological anatomy, and kind of stitching those two things together is what makes a good radiologist. Every case is like a puzzle that needs to be solved. I'll give you an example. I remember there was a 30-year-old man who walked through the front door with chest pain and high blood pressure. You wouldn't normally think much of this. You think, okay, looks probably nothing, discharge back to the GP. They did a chest x-ray, and to the eye, the chest x-ray looks normal, but actually there is some very subtle inferior rib notching. Now, that rings alarm bells in the radiologist's mind because that can signify that this patient has a problem with their circulation. So based on that, the radiologist recommended, hey look, don't send this patient home, he needs a CT. So we did a CT scan, and lo and behold, the patient had coarctation of the aorta. And that case always stands out to me because most clinicians in A&E or on the wards just wouldn't have picked that up. But there is the radiologist pulling together all the different bits of information, looking at the history, looking at the patient age, and actually stitching together a diagnosis. So if you love problem solving and puzzles, you will love radiology. And on that point, I think that's what actually makes a good radiologist. You hear of so many, memes about clinical correlation advised, but actually a good radiologist will look at the blood, will look at the history, will look at the previous histology, stitch it together with the imaging and give you the diagnosis, i.e. the radiologist should be doing the clinical correlation as far as possible. So fourthly is variety. In radiology, you're looking at imaging from the head to the toe, from a neonate to someone who's 105 years old or beyond. I remember before I actually went to medical school, I was seriously considering doing dentistry. But I realized actually when I did my work experience that it just wasn't for me because you're just focused too much on one part of the body. And as I went through medical school and went through my rotations, I realized I need to do something with variety, and radiology provides you exactly with that. Your average work week will be split between acute reporting, so that's reporting scans that come through A&E and through inpatients. You'll do some cold reporting, which is reporting outpatient scans. You'll do some ultrasound, you might do some intervention, you'll do different modalities like X-ray, CT, MRIs. So there really is a lot to get on with, and it's not just sitting in a dark room doing one thing, it's sitting in a dark room doing lots of different things. And actually radiology is very social. You'll be sat next door in your little cubicle to your colleagues, and you'll be chatting and you'll be discussing cases. And actually I found that it's probably one of the most social specialties that I've done in all of my training really. And not only that, the volume of interesting cases you see is huge. I remember when I was back in the day preparing for my PACES exam as part of the MRCP qualification, I would be running around the wards asking consultants, hey, do you have a murmur? Do you have a patient with multiple sclerosis? Do you have a patient with Parkinson's disease? But in radiology, every day you're seeing tons of interesting cases because naturally patients who are walking through the front door will have some sort of a chest x-ray at the very least, or many of them will have CT scans, and you can look at these images and they have interesting findings. Whereas when you're running around on the wards, you might see one or two interesting cases in a whole day. And that's just what makes the job really exciting. So fifth, and probably one of the most important reasons, I don't think it's something we should shy away from, but is the financial flexibility that you have in radiology. An NHS consultant earns just over 100,000, and a resident or a registrar, depending on where you are in your training, can earn anything from kind of 40 or 50-ish to 75,000. And if you're living in London or living anywhere in a big city, cost of living is tough. So you do need to think about, how am I going to earn my money? Radiology training is relatively short, it's 5 years, you get to consultant quite quickly, and there are opportunities to boost your income. So there's something called insourcing. That's basically where hospitals have backlogs of scans, so your own hospital will pay you to report off the backlog. And usually they'll pay you a fee per scan. So as an example, you might get £3 an X-ray or £30 a CT scan. And obviously if you're quick reporting, you can get through lots of images and lots of scans, then you can comfortably be making 150-ish an hour, if not more. And that's very common, and you can definitely supplement your income by tens of thousands of pounds a year doing that. The other option that is super common is teleradiology, also known as outsourcing. So that's a similar concept, but this time hospitals are sending their backlogs to companies who have radiologists working for them, and the radiologists will then report those scans. Now, there's upsides and downsides to that. Probably not going to get into that in this video, but the point is there is plenty of work available and plenty of ways to supplement your income. And then of course there is the private sphere. So when you become a bit more senior and a bit more established and you make your links with the clinicians, they will send you their private patient scans to report in the private sector. And of course that's another way that you can supplement your income. And the way I kind of think about this is, when I was working on the wards, I would do locum shifts and I'll be making kind of £50 or £60 an hour, grueling, grafting, seeing patients, running around. Whereas in radiology, again, you're getting paid per scan to sit down, drink some tea, and make money. So I think that's really, really great. And finally, I will give you one more bonus reason, and that is technology. The NHS in some parts of this country still reports or still documents on paper. Whereas in radiology, you'll have the nicest equipment, you have computers which switch on quickly within a minute of pressing the button, not 30 minutes like you do on the wards. You have software that works. You have kind of 3 screens usually with beautifully crisp monitors. You have, you know, in some cases AI integrated into that software, and that can help you. It's at the forefront of technology. And I found that quite refreshing coming from the wards. So yeah, I hope you found that video useful. I do hope I've somewhat convinced you to become a radiologist. If you have any questions at all, feel free to leave a comment, and please do subscribe, share, and like in that exact order.